Hello everyone, how are you doing? I hope you're doing fantastic. I miss all of you. This is take 6 because first time I didn't realize how fast 5 minutes go by. The most recent time I realized my mic wasn't recording. So let's go. Let's start from the beginning. The beginning here is April 15th, 2020. At that point in time, there were 2 million confirmed cases worldwide. 648,919 confirmed cases in the US. If we fast forward 6 days in the future to April 21st, 2020, there are 824,698 confirmed cases. 2.5 million confirmed cases worldwide. That is a pretty big jump in just 6 days. In recent weeks and at this point in time, states have put in place stay-at-home orders. Others, some like Idaho, has extended these orders, while others have began to lessen or lift some of the restrictions on these orders. For this situation, this current situation, I picked the trends theoretical model for intervention and evaluation in this situation because it captures pretty well what people need to do to better control these infection rates. It's comprised of 5 steps: pre-contemplation, contemplation, preparation, action, and maintenance. Pre-contemplation is people aren't aware that their current behavior is problematic in the future. Contemplation, people are starting to recognize that their behavior is problematic, and they start to look at pros and cons of their continued actions and behaviors. Preparation is people are intending to take action in the near future, to make changes, and they begin to make small steps towards change in behavior. Action, people are actively making changes to their behavior and acquiring new healthy behaviors and habits. And finally, maintenance, people have been able to keep this new behavior for 6 months and are working to prevent relapses. A big example for this is washing your hands. And obviously you can apply this to many different things that include hygiene. Washing your hands is a big one. People don't realize how much of a hazard it is when you don't wash your hands, especially in this time when we're trying to keep infections to a low rate. We have to keep reminding people to wash their hands. It hopefully has worked. Actions in the past, besides related to hygiene, what we've been doing with like with H1N1, there was also the Spanish flu. I don't want to call it that. The flu of 1918 to 1919. With H1N1 specifically, we had travel restrictions in place. There was social distancing in place as well. Quarantine, isolation. The use of face masks was also used at this time. At that time, and even now, it's still currently hotly debated whether these face masks provide real protection. Although recently the CDC did say that it's probably advisable to it is advisable to cover your face with a mask, cloth. Cover your mouth and your nose to try and negate this infection and spreading it. Community-wise, this is going to affect everyone: state public health, CDC, national public health, WHO, global health organizations, and this project was more targeted towards people who have struggle getting health care, people who are immigrants to this country. Specifically, they don't have a lot of the benefits that we do, and because of that, it's harder for them to get care or to get information. Many of them don't speak English, or they don't speak English well. They are illiterate. So we need to find ways to provide this information to these certain demographics of people. They're here. They are no less important than anyone else. Moving forward, what we can do is that we cannot simply rely on a vaccine for the solution. That is the most important thing. Vaccines take a long time to create. It will most likely not be ready until early next year. We cannot rely on that alone for an answer. Social distancing is the most effective at prevention, and we have to be prepared for future pandemics. This is not the first, and it's not going to be the last. Most importantly, I want you guys to stay safe. Hopefully you guys are doing okay. Thanks.